Heart disease is quite common in the older population as the blood supply to the heart can become compromised secondary to other disease processes, such as diabetes, high blood pressure, and atherosclerosis. Elderly individuals with heart disease are at the greatest risk of cardiac arrest and death. Thus, these individuals are often likely to benefit from a cardiac device such as a defibrillator. Not only does the elderly population have the highest prevalence rates of defibrillators, but they also benefit the most from their function. In fact, in a 2014 published study, it was found that those with even just a few risk factors for cardiac arrhythmias, such as age, will benefit the most from implantable defibrillators. Because of the success of defibrillators, the rates of implantation have increased exponentially over the years since their inception. In what follows, we'll discuss the characteristics of defibrillators, what they do, and why the older population can benefit from the function of such a device. Defibrillators are medical devices that are implanted via a surgical procedure and function to restore the electrical activity of the heart and the heartbeat after the heart experiences cardiac arrest. It accomplishes this feat by sending an electrical shock directly to the heart muscle and stimulating the heart to begin functioning again. Internal defibrillators are primarily placed in individuals who have certain heart conditions such as coronary artery disease and ventricular tachycardia. These conditions make these individuals at high risk of cardiac arrest, and the internal defibrillator performs a life-saving function. External defibrillators have already been used for many years in the emergency situation of cardiac arrest and are a standard device found in multiple stations in a hospital. They are also carried on all emergency vehicles and are located at many public locations. Three types of defibrillators used regularly include implantable cardioverter defibrillators, ICDs, wearable cardioverter defibrillators, WCDs, and automated external defibrillators, AEDs. Implantable cardioverter defibrillators are devices implanted surgically in the chest wall in patients who suffer from arrhythmias. These devices can also have the dual function of defibrillator and pacemaker in specific types of these devices. This makes these devices even more helpful to individuals with additional heart conditions. Wearable cardioverter defibrillators are external devices that attach to the skin on the chest wall, and they deliver electrical shock signals when needed. WCDs are the primary choice of defibrillators for those who cannot have an ICD placed immediately, but they still need the protection of a defibrillator. Automated cardioverter defibrillators are portable medical devices that use electrodes that attach to the chest and can automatically determine a heart rhythm and deliver an electrical shock to treat an arrhythmia. The advantage of the internal defibrillator is that the device will deliver a life-saving shock immediately at all times. The wearable device is only effective when it is in place. Again, AEDs can only be helpful when they are attached, and this usually occurs when an individual has sudden cardiac arrest. There will be a delay between the onset of cardiac arrest and the delivery of a shock in the case of the use of an AED. Thus, the ICD has a tremendous advantage for appropriate individuals. The following are the most common indications, according to the American College of Cardiology, for treating elderly patients with implantable cardioverter defibrillators. Survived cardiac arrest due to ventricular tachycardia. Existing structural heart disease. Patients less than 40 days post-myocardial infarction. Patients with dilated cardiomyopathy. Awaiting cardiac transplantation. Even with the help of these identifiable indications, clinical cardiologists find it increasingly difficult to measure whether or not defibrillators, particularly implantable defibrillators, are the right choice of treatment for their elder patients. There has not been a defined universal age for the proper use of internal defibrillators at this time, and this will likely be a mutual decision involving the patient and cardiologist. Success rates of defibrillators. Success rates of defibrillators as a primary treatment for cardiac events and arrhythmias depend on a variety of factors. Some of those factors include circumstance, timing, type of defibrillator, the severity of the event, and age. The factor that seems to play the largest role in the success of the internal defibrillator is the timing of implantation. Once the device is implanted, the individual is protected. In the case of external defibrillators, the success is dependent upon the actions taken within the first few minutes of the cardiac event taking place. This is largely illustrated in the 2018 study examining the benefit of immediate bystander responses using defibrillators, reporting an annual 1,700 lives saved in the US alone as a result. In fact, when CPR and defibrillation take place within the first 3 minutes of the event occurring, survival rates increase to 70% overall. Further, if the patient is shocked with a defibrillator within the first minute, survival rates increase to 90%. Final thoughts. The internal defibrillator is a significant medical advance in the field of cardiology. As indicated in the studies noted, the timing of a shock is the key to success rates for the treatment of arrhythmias, and an internal defibrillator will provide the quickest delivery of a shock compared to any other device. This demonstrates their clear benefit to individuals with these heart conditions.